if I could get upper sacrum, that would be ideal. Look, palpating the back, fundamental importance, right? You can't call yourself an acupuncturist if you can't locate back shu points. So I think as per Acu 101, we've memorized, I hope, right? The bladder number and the vertebral process, or the lower border of, I should say. So if I nudge these shoulders down, this should put the angle of the scapula at about where T7 should be, or actually what I do is I cheat a little bit. The angle should be level with the tip of T7, but because we want to palpate spaces and not prominences, I just push my finger down beyond that angle and then move over and find my space rather than the prominence. And so I've got my finger here on what I believe to be T7.
Where are the dots?
Where are the dots? Yeah, they're in room 6. Do you mind if I just draw on you a little bit?
Not at all.
So I think that's 7, but I don't really know until I count up or down to my other landmarks. Right? And having palpated a bunch of spines, I'm going to suggest it sort of is, but 6, 5. 5 is usually like almost mid scapula. So if I from the spine to the angle should be about midway. That looks approximately midway. That could be 5. 4, 3, 2, and 1, and that looks like we're probably 1. 3, back to 3, is usually level with our spine. So I could mark a face shu here if I wanted, very easily by using the medial border of the scapula as my 3-tsun line, and my midline as my center point, and then my midway would be face shu, for example, right? All of these points should be needled like so. Our huato points need to be perpendicular, and they can be found anywhere between a half-tsun lateral to the midline to a full-tsun lateral to the midline. These should be needled perpendicularly. Our inner bladder line should be perp oblique, and our outer bladder line should be transverse oblique, all centered towards the center of the spine. Now, I think those of you that have taken orthopedics will know also that we can certainly needle this outer bladder line transverse oblique laterally. That's fine. It's just not traditional. It's not what you'd find in your textbooks, right? So generally speaking, from our duma, actually we should do dew points as well, right? Mm-hmm. Which are essentially perpendicular until we get up to thoracic, which will be angled slightly superior, and then we get back into perpendicular as we move up and into the neck. Our moving from midline to outer, we should be perp oblique, transverse oblique, essentially. So moving like this and moving like this, essentially, as we move. Inner bladder line, nice and easy to find with this medial border of the scapula. To go midway, we can also use the peak or the height of the erector spinae as we move down. If we're not sure about our T7, we can use the articulation of C7 and T1. This is not my favorite method, but we can certainly use this. I don't like to use it because I'm often treating neck stuff. If you've treated somebody with whiplash, you don't want to have them start wrenching around their neck around so that you can fumble around and find vertebral processes, right? I'm probably going to move down to my lower landmarks and even count all the way up, right? So T1 is usually quite prominent on some folks. C7 is a little bit more prominent. That might trip you up as well. So if you're able to, I find it much easier to do with your patients seated or standing. If they can go all the way forward and all the way back and side to side, you can initially guess what you think is, put one finger on what you think is T1 and on the other finger what you think is C7. Of course, the cervical vertebrae should move and the thoracic should not. But down to the sacrum is usually where I'll go, and I'll find first the prominences of the PSISs, and then I'll recall that medial to these is still going to be sacrum. Medial to your, oh, Kate's in rough shape here.
She's ready to graduate.
Yeah, she doesn't even have any more SI joints. But assuming that Kate was correct, that in between those two prominences, I'm still at the level of the sacrum, right? I would still be palpating a sacral spine if I was to go immediately in between these two prominences. So I have to go between them, but then also palpate upwards until I find the most prominent space there. That will be that will assuredly be my L5, S1. And you can see that's about a ton above the level of the prominences of the PSIS. I'll do this all the time, and this is actually only recently. I'd say I've only started using this landmark, I want to say, in the last maybe 5-6 years. But
Sorry, can you say it again, Ted?
of course. So let's do it this way. Medial to the prominences of the PSISs and superior, so medial and about 1 cent superior, you should find the space between L5 and S1.
Okay.
And I would suggest that unless you've got some pretty massive hip misalignment, usually this prominence, or this depression I should say, the space between the 5th and the 1st sacral is quite prominent. Like, it's pretty hard to miss, and I can get my finger right in here pretty easily.
What's that extra point called?
Situation.
Yeah.
Yeah. 5, 4, Lanway Shui is gallbladder.
Right.
Yeah. So 5, 4, 3, 2. I'm pretty certain that I'm on 2 right here because I can see very clearly this space between where the ribs end and the hips start. And this is about where you're going to find bladder 23 or the kidney shoot point.
Between that space, like in the midpoint?
A lot of us will have a little divot here as your rib cage is out here, comes in towards the hips, and then the hips come out.
And it's kind of in line with the divot.
Yes, correct. So 2, 1, 12, 11, 10, 9. 10 and 9 are usually quite close. 8, and there's my 7. So worked out.